I'm Dr. Rodrigo Bolaños. I am a specialist in orthopedic surgery and trauma. I have a subspecialty in hand surgery. I did my specialty here in Guatemala in the social security system under the Universidad de San Carlos control, and I did my fellowship in Bogotá, Universidad del Bosque, in hand surgery for 1 year, and then I returned here to Guatemala to practice and treat my patients. I'm going to talk about carpal tunnel syndrome, that it's one of the most frequent problems that you will encounter in hand surgery, and it's a frequently complaint that a lot of patients have. So I'm going to be brief about this. The median nerve is the problem. It's the most important nerve in the hand. It goes through the carpal tunnel. The carpal tunnel is a structure, as it's named, carpal tunnel. It's a tunnel. Its floor is formed from the bones of the wrist, and the ceiling is the transverse ligament. And when anything that occupies space or the tendons are inflamed, obviously the volume will go up, and it will compress or press the median nerve. And that's the big problem, because it's really the one that makes you feel your thumb tip, your index tip, your middle finger tip, and the half of the annular fingertip. And also it's the one that provides all the motor electricity to move your thumb. It's the one that's responsible for doing the opposition move that makes you grasp and pinch things. And it's very, very important nerve. So when anything that occupies space inside the carpal tunnel, it will affect this nerve, because it's going to press against it and will make the flow of the blood flow diminished, and that makes the nerve numb or starts doing its damage. Mm-hmm. So the first things that you feel when you have a compression in your carpal tunnel syndrome, you feel numbness in your fingertips, especially in the thumb, index, and middle finger. And when you let that happen for a long time, then suddenly you can stop feeling it, and then you say you're relieved, or you got away with no surgery or no treatment. But the problem is that really the nerve is so damaged that you can't feel anything more, and then you start losing your ability to do the opposing thumb and index, and that's where the real problem begins, because when you treat it early in the disease course, you can alter this situation and don't affect the movements of your thumb. So it's very important to consult when you have problems with that, or when you feel numbness in your fingertips, because it's usually easy or not so difficult to eradicate the problem and avoid being with a thumb that doesn't move, or a thumb that's losing its strength, and you have to be very careful with that. Another thing that you have to understand is that the surgery is the last thing that you will have as a treatment, because first of all you start with physical therapy, behavior changes in your work, pauses when you do work, exercises, medications you can use also, splints during the night to sleep. And if all that fails, and you have tried it for a long time, or especially 3 months, you can start doing some of the other workup, like sonogram or EMGs, to see how the nerve's doing. And if really it doesn't work, the non-surgical treatment, then we perform the surgical treatment. The surgical treatment is obviously, if something's trapping something, you have to cut it and relieve it. In this case, it's the belt. It's the belt that's the annular ligament that goes in the ceiling of the carpal tunnel, and you have to cut it and release the nerve. and that's really a very good surgery if indicated, and the results are very, very good if indicated and done as it should be done.